Wanna pass your NCLEX? Then let's get started. Today we'll be covering a pediatric case study as outlined in the NCLEX NGN test plan. Sarah, a 4-year-old child, is brought to the pediatric clinic by her mother with complaints of fever, cough, and difficulty breathing. Sarah has a history of asthma and allergies. Upon examination, Sarah is febrile, tachypneic, and wheezing is auscultated bilaterally. Her oxygen saturation is 92% on room air. The mother reports that Sarah has been using her rescue inhaler more frequently over the past few days. Based on this information, the nurse suspects an exacerbation of asthma. Question 1. Which of the following signs and symptoms is consistent with an asthma exacerbation in Sarah? Bradypnea, decreased respiratory effort, wheezing, decreased heart rate. Pause the video and select your answer. If you chose option C, you are correct. Wheezing. Wheezing is a common symptom of asthma exacerbation and indicates airway obstruction. It is caused by the constriction of the bronchioles and is typically heard more prominent during expiration in some cases. This is consistent with Sarah's history of asthma and difficulty breathing. Question 2. What is the priority nursing intervention for Sarah at this time? Administer antipyretics, provide supplemental oxygen, administer a nebulized bronchodilator, administer corticosteroids orally. Pause the video and select your answer. If you chose option C, you are correct. Administer a nebulized bronchodilator. Administering a nebulized bronchodilator, such as albuterol, is a priority intervention to relieve airway obstruction and improve breathing in a child experiencing an asthma exacerbation. This helps to dilate the bronchioles and alleviate wheezing. Question 3. What assessment finding indicates a severe asthma exacerbation in Sarah? Tachycardia, mild retractions, oxygen saturation of 92%, able to speak in full sentences. Pause the video and select your answer. If you chose option A, you are correct. Tachycardia. Tachycardia is a common sign of severe asthma exacerbation and indicates increased work of breathing and possible hypoxemia. It is a compensatory mechanism to maintain cardiac output in response to respiratory distress. Question 4. Which medication is commonly used as a rescue inhaler for acute asthma symptoms? Beclomethasone, Montelukast, albuterol, fluticasone. Pause the video and select your answer. If you chose option C, you are correct. Albuterol. Albuterol is a short-acting beta agonist bronchodilator commonly used as a rescue inhaler for acute asthma symptoms. It works quickly to dilate the bronchioles and relieve airway obstruction during an asthma exacerbation. Question 5. What education should a nurse provide to Sarah's parents to help manage her asthma exacerbation at home? Encourage Sarah to drink plenty of fluids, teach Sarah's parents how to use a peak flow meter, advise Sarah's parents to limit physical activity, instruct Sarah's parents to keep her warm and bundled up. Pause the video and select your answer. If you chose option B, you are correct. Teach Sarah's parents how to use a peak flow meter. Educating Sarah's parents on how to use a peak flow meter is crucial for monitoring her asthma at home. A peak flow meter measures how fast air can be blown out of the lungs and helps determine the severity of airflow limitation, providing an early indication of worsening asthma symptoms. By monitoring Sarah's peak flow readings regularly, her parents can detect changes in her asthma control and adjust her treatment plan accordingly, potentially preventing exacerbations or identifying them early for prompt interventions. Question 6. What is the expected outcome of administering a nebulized bronchodilator to Sarah? Reduced fever, improved airway obstruction, decreased heart rate, increased respiratory effort. Pause the video and select your answer. If you chose option B, you are correct. Improved airway obstruction. Administering a nebulized bronchodilator is expected to improve airway obstruction by dilating the bronchioles, thereby allowing easier passage of air and relieving wheezing and respiratory distress. Click that subscribe button and join us next Wednesday.